Hello, my name is Ben Johnson and I'm an advanced clinical practitioner at University Hospitals Birmingham, and I'm presenting this poster on behalf of myself and Dr. Vanya Giljaka, a consultant gastroenterologist working in the same trust. The title for this poster is that Plenvu is non-inferior to MoviPrep in terms of taste, volume, ease of use and overall bowel cleansing quality scores. When patients undergo a colonoscopy test to investigate their lower gastrointestinal tract, they are required to consume a bowel cleansing agent or laxative to ensure that the colonoscopist can adequately visualise the colonic mucosa and reliably identify or exclude significant pathology. The current bowel prep used within the trust is called MoviPrep, and this is consumed as a 4 litre polyethylene glycol or PEG based osmotic laxative over a period of a few hours on the day before the procedure or the morning that the procedure is due to take place. This laxative can be very unpleasant in taste and the volume quite intense to consume, and so some studies have shown that bowel cleansing agents which are lower in volume overall are often better tolerated and are associated with more optimum bowel cleansing quality, particularly in the right or ascending colon. One such product which has been proposed within the trust is called Plenvu. This is a polyethylene glycol or PEG based osmotic laxative just like MoviPrep, but it's consumed in a volume of just 2 litres, which is half the volume currently used within the trust for MoviPrep. However, prior to making the switch to this alternative preparation, a prospective audit of the current and the proposed treatment was arranged and completed through a patient evaluation and an evaluation of its effectiveness, comparing the two laxative treatments using 2 validated bowel cleansing quality scores. So the aims and objectives of this prospective audit then were to compare Plenvu versus MoviPrep in terms of the taste, the volume and the ease of use, to evaluate and compare Plenvu versus MoviPrep in terms of any side effects experienced by the patients, and finally to evaluate and compare overall and ascending colon cleansing quality of Plenvu versus MoviPrep to see if one is more optimal than the other. In terms of the methods used for this prospective audit, it was conducted as a single centre prospective audit across Heartlands, Good Hope and Solihull Hospital sites at University Hospitals Birmingham. All outpatients attending for a colonoscopy camera test for their pre-assessment appointment between February and April 2023 were included, and this was a total of 763 participants. The patients were placed into 3 separate groups. Those attending in the February month were put into Group 1, those in March were put into Group 2, and finally those in April were put into Group 3. Group 1 participants were given MoviPrep at the standard 4 litre volume used within the trust. Group 2 participants were given Plenvu, the new prep, at a standard manufacturer recommended volume of 2 litres, and Group 3 participants were given Plenvu, but this time in 3 litres of fluid in total. And the reason for this is that the standard manufacturer volume for MoviPrep is actually 3 litres, but an additional 1 litre of fluid is always used as standard practice within the trust due to previous issues with the cleansing quality of the original prep. Therefore, to reduce the bias in favour of MoviPrep, since we already give it with additional fluid, Group 3 was created as a result. For data collection, we collected patient feedback through way of a paper questionnaire, and this was completed on the day of their procedure that it was due to take place. Bowel cleansing quality scores were recorded immediately following the patient's procedure by the endoscopist within the theatre room using two validated scores. One is the hair-filled bowel cleansing scale shown in figure 1 below on the poster. Patients were given a score in each segment of their colon, and depending on the score they would be given an overall grade. And patients with a hair-filled grade C or D in any of the bowel segments were classed as having failed the bowel preparation. To reduce the risk of any reporter bias, a second reporting tool was used, and this is shown in figure 2 and is known as the Boston Bowel Cleansing Scale. Scores were obtained retrospectively from the endoscopy database by myself to establish what the overall bowel cleansing quality score was according to the Boston Bowel Cleansing Scale. The results of both scoring systems were then looked at side by side to ensure that the results were consistent and to ensure that no significant bias had occurred in one versus the other. Then statistical analysis was completed. Now, looking at the results, overall there was no statistically significant difference between Plenvu and MoviPrep in overall bowel cleansing quality, and those results are shown in graph 1. There was also no significant difference in ascending or right colon cleansing quality according to the hair-filled bowel cleansing scale, and those results are shown in graph 2. Overall, the Boston Bowel Cleansing Scale scores also mirrored these findings with no significant difference. The lower volume of Plenvu in group 2 and group 3 seemed to have an overall higher acceptability amongst patients when compared with MoviPrep. However, there was no significant difference statistically between Plenvu and MoviPrep in terms of the taste, the volume, or the ease of use when a full statistical or post hoc analysis was completed, and these results are shown in table 2 below. The most commonly reported side effect in all groups was nausea and/or vomiting, and these are both listed as common side effects within both product literatures, and all other reported side effects which were recorded and experienced by participants through a thematic analysis are actually listed within the product literature, and therefore no unexpected side effects were experienced or reported. So in conclusion, overall, from our prospective audit, we were able to conclude that MoviPrep and Plenvu were comparable in terms of their overall and ascending bowel cleansing quality, and that Plenvu actually seemed to have a higher acceptance among patients in both groups 2 and group 3, but more so in group 2, due to its lower volume, although this did not reach a level of statistical significance. The findings overall presented here are aligned with the wider available literature and the real-world data currently available, and therefore we could conclude that overall Plenvu offers a lower volume alternative to MoviPrep, which will be considered for rollout throughout the trust. Thank you.